All of the changes that I've mentioned this afternoon will force us to think differently and be even more strategic. Let me end by recapping some of the things that the school is doing to prepare for, for a successful future. We've entered an era demanding far greater economic efficiency in all of our missions. Like our peers, we must adapt to the financial environment by optimizing our research portfolio and prioritizing investments. Both at the level of the school and at the level of each individual investigator, we have less flexibility than we used to have, and we have to be more focused on efforts that will yield the most progress in understanding biology and disease and in improving human health. The school's administration is working closely with department chairs and other leaders to ensure that we continue to evolve and improve as we adapt to this new reality. We have implemented and will continue to implement tactics to spend less and be smarter. Our administrative team is preparing for the NIH's new closeout initiative, something that you've probably not heard much about yet, but you'll hear more. This is a very big undertaking, but we have no choice, and we should make it an opportunity to improve how we do things. We're implementing new strategies to increase energy efficiency and reduce expenses. This contributes to Duke's sustainability efforts, and it also allows us to use our precious resources for academic purposes. We will reduce building operations expenses and pursue opportunities to lease space that costs less. I still hope that we will be able to expand our on-campus research space within the next decade, but now is not the time. And finally, the school is committed to developing and implementing a strategic plan for information technology, again under Ian Sanderson's leadership, to ensure that the faculty, staff, and students have the IT resources and the services that they need. This requires upfront investment, but it should make us more efficient and effective over the long term. As the chairs know well, we are scrutinizing every new faculty hire to ask whether we are making the right choices about priorities and to make sure that we identify the strongest possible candidates. To recruit and retain the best people, we are expanding and enhancing our efforts to create a diverse, supportive work environment for faculty, staff, and students, particularly recognizing the unique needs of groups underrepresented in academic medicine. Diversity strategic plans have been created and are being implemented by chairs and directors. We continue to focus on improving mentoring to help all faculty members reach their full potential. And we recognize the importance of sustained attention to addressing disparities in mentoring, career development, and advancement of underrepresented minorities and women. To optimally leverage scarce research funding, we will continue to promote collaborations and partnerships between basic science and clinical departments, between departments, institutes, and centers, and between the School of Medicine and other Duke schools. We're increasing our focus on industry and philanthropy as funding sources to complement grants from government agencies. We've developed a large collection of core facilities and shared resources to support and facilitate research in the School of Medicine, and I believe that they give us a real edge over many of our peers. And as I mentioned earlier, the faculty development and mentoring programs developed by Mark Dewhurst and Ann Brown position our faculty well for success. Ed Buckley, Colleen Grochowski, and their colleagues, both here and at Duke and US, have been exceptionally innovative in medical education, and they continue to explore and evaluate new ways to help our students learn. We're at the cutting edge in considering approaches such as sharing core curricula with other institutions, using gaming to engage a generation that grew up with video games, using flipped classroom activities to enhance learning, and making full use of simulation. In past years, I've told you about our primary care leadership track for medical students started in 2011. That program has matured and is attracting a very strong cohort of applicants interested in community health. Primary care leadership track and larger class sizes in our PA and DPT programs, along with the other new programs I mentioned earlier, help us to respond to future needs for a strong healthcare workforce. The health system has been working to reduce costs, be more efficient, increase the quality of care, most recently with the help of an external consultant. This will be important to stay competitive and financially healthy in a challenging environment. We all know, however, that this must be done in a way that doesn't threaten our education and research missions, which are critically important for our reputation and for providing our patients with the very best care. I want to thank our faculty, staff, students, and trainees for their hard work and their commitment to all we do. We're very fortunate to have a community of people who bring a tremendous array of skills, talents, insights, and perspectives. As we have always done, we will continue to evolve and improve, and working together, we will face the challenges that lie ahead, and undoubtedly, we will surpass expectations. We will continue to live up to President Terry Sanford's notion of outrageous ambition. In fact, if you have any doubts about that, just Google it. As I end today, I hope I've left you with confidence that we are very well positioned for the future. We have a history of progress and success and a track record of extraordinary achievements. We have strong and capable leaders and outstanding researchers, clinicians, learners, and staff. Change is certain, but what is more certain is Duke's ability to rise to whatever challenges present themselves. That's who we are, and I am very proud to be part of this incredible team. On the last slide, I want to give a special thank you to our senior leadership group for all that they do every day. Thank you all, and I'd be very happy to answer any questions.